Have you ever found yourself clearing your throat over and over again, feeling like something is constantly stuck there, yet no matter how much you cough, swallow, or sip water, it never truly goes away? It can happen during conversations, while eating first thing in the morning, or even right before bed. Many people assume it's just extra mucus, but what if that mucus is actually your body's way of telling you something important? Here's what surprises many people. The mucus itself is often not the real problem. In many cases, it's simply the result of another condition that has been quietly developing for weeks, months, or even years. That condition might be allergies, chronic sinus inflammation, silent acid reflux that causes no heartburn at all, dry air, certain medications, or even an underlying illness that deserves medical attention. The challenge is that many people try to fix the symptom instead of identifying the cause. They buy cough drops, drink endless cups of tea, or constantly clear their throat, only to find that the problem keeps returning. Without understanding what's triggering the excess mucus, lasting relief can be difficult to achieve. In this video, we're going to uncover the real reasons why mucus builds up in your throat, explain how your body actually produces it, discuss the most common medical conditions behind persistent throat mucus, reveal everyday habits that may be making the problem worse, and walk through the treatments doctors commonly recommend based on the underlying cause. By the end, you'll have a much clearer understanding of what may be happening and when it's time to seek professional evaluation. So stay with me until the end. One of these explanations may finally connect the dots you've been missing. Many people believe that mucus in the throat is the problem, but in reality, it is often a clue that something else is happening inside the body. Healthy mucus plays an important role by trapping dust, bacteria, viruses, and other tiny particles before they reach the lungs. However, when you constantly feel the need to clear your throat, it usually means your body is responding to irritation rather than simply producing too much mucus. One of the most common reasons is postnasal drip, where mucus from the nose and sinuses slowly drains into the back of the throat. Another frequent cause is laryngopharyngeal reflux, often called silent reflux, in which stonic acid reaches the throat without causing the typical burning sensation of heartburn. Allergies, dry indoor air, smoking, vaping, pollution, and even certain medications can also trigger excess mucus production. Unfortunately, many people spend months treating the symptom instead of identifying the underlying cause. They rely on cough drops, throat lozenges, or repeatedly clearing their throat, which can actually make irritation worse over time. Understanding why the mucus is there is the first step toward lasting relief. Once the true cause is identified, the right treatment can often reduce throat irritation, improve comfort, and help prevent the problem from returning again and again. Mucus often gets a bad reputation, but the truth is that it is one of the body's most important protective tools. Every day, your respiratory system naturally produces a significant amount of mucus to keep your nose, throat, and airways moist while trapping dust, bacteria, viruses, pollen, and other harmful particles before they can reach your lungs. Tiny hair-like structures called cilia constantly move this mucus toward the throat, where it is usually swallowed without you ever noticing. This process happens all day long and is a normal part of maintaining a healthy respiratory system. Problems begin when the mucus becomes thicker, stickier, or is produced in larger amounts than usual. Allergies, viral infections, sinus inflammation, dehydration, dry air, cigarette smoke, and environmental pollutants can all change the consistency of mucus, making it much more noticeable. In some cases, silent acid reflux can irritate the throat and trigger extra mucus production as the body attempts to protect the delicate tissues. The color of mucus can also provide clues. Although it does not always indicate a bacterial infection, clear mucus is often associated with allergies or irritation, while yellow or green mucus may appear as the immune system responds to an infection. Understanding that mucus itself is not the enemy helps shift the focus toward finding and treating the underlying cause instead of simply trying to eliminate the mucus itself. One of the biggest reasons people struggle with constant mucus in the throat is that several different conditions can produce the exact same symptom. The most common cause is postnasal drip, where excess mucus from the nose and sinuses slowly drains down the back of the throat instead of flowing out through the nose. This often happens because of allergies, chronic sinus inflammation, the common cold, or seasonal changes. Another major cause is laryngopharyngeal reflux, also known as silent reflux. Unlike typical acid reflux, it may not cause heartburn at all. Instead, stomach contents travel up into the throat, irritating the tissues and prompting the body to produce more mucus as a protective response. Environmental factors can also play a significant role. Dry indoor air, cigarette smoke, vaping, air pollution, chemical fumes, and even strong perfumes may irritate the lining of the throat and increase mucus production. In some cases, persistent throat mucus may be linked to chronic infections, asthma, or less commonly structural problems involving the nose or throat. Certain medications and dehydration can make mucus thicker and more difficult to clear, creating the sensation that something is constantly stuck in the throat. Because these conditions often overlap, identifying the true source of the irritation is essential. A careful medical history, physical examination, and sometimes additional testing can help determine the underlying cause so that treatment targets the problem rather than simply masking the symptom. Many people unknowingly make their throat mucus worse through everyday habits that seem harmless. One of the most common is frequent throat clearing. While it may provide temporary relief, repeatedly forcing the throat to clear creates additional irritation and inflammation, which can stimulate even more mucus production. Over time, this becomes a frustrating cycle that is difficult to break. Dehydration is another major contributor. When your body does not get enough fluids, mucus becomes thicker and stickier, making it much harder to swallow or clear naturally. Drinking adequate water throughout the day helps keep mucus thin so it can move more easily through the respiratory tract. Smoking and vaping are also significant irritants. The chemicals in tobacco smoke and vaping products damage the lining of the airways, slow the movement of the tiny cilia that normally clear mucus, and trigger the body to produce even more protective mucus. Diet can play a role as well, especially for people with silent acid reflux. Large evening meals, spicy foods, fatty foods, chocolate, caffeine, alcohol, and carbonated drinks may worsen reflux and increase throat irritation. Even the air inside your home matters. Dry air from heating or air conditioning can dry out the throat, while dust, pet dander, mold, and other indoor allergens may continuously irritate the airways. Recognizing and changing these daily habits can significantly reduce throat irritation, and when combined with proper treatment of the underlying cause, often leads to noticeable improvement over time. When someone has persistent mucus in the throat that lasts for weeks or keeps coming back, the most important step is identifying the underlying cause rather than simply treating the symptom. Think. A doctor will usually begin by asking detailed questions about when the mucus started, whether it is worse in the morning or at night, if it is associated with coughing, hoarseness, difficulty swallowing, heartburn, nasal congestion, allergies, or exposure to smoke and other irritants. These details often provide valuable clues. A physical examination may include looking inside the nose, mouth, and throat for signs of inflammation, infection, swelling, or excessive mucus. If allergies are suspected, allergy testing may be recommended to identify specific triggers, such as pollen, dust mites, mold, or pet dander. In cases where postnasal drip or chronic sinus problems are possible, a specialist may perform a nasal endoscopy using a thin, flexible camera to examine the nasal passages and sinuses more closely. If silent acid reflux is suspected, your doctor may recommend lifestyle changes, a trial of reflux medication, or specialized testing to confirm the diagnosis. Occasionally, imaging studies such as a CT scan of the sinuses or additional evaluations by an ear, nose, and throat specialist are necessary, particularly if symptoms are severe, persistent, or accompanied by warning signs like unexplained weight loss, persistent pain, coughing up blood, or difficulty swallowing. Full evaluation helps ensure that treatment is directed at the real cause, giving you the best chance for lasting relief. The most effective treatment for persistent throat mucus depends entirely on what is causing it in the first place. There is no single medication that works for everyone because excess mucus is usually a symptom rather than the disease itself. If dehydration or dry air is contributing to the problem, drinking plenty of water and using a humidifier can help keep mucus thin and easier to clear. For people with postnasal drip caused by allergies or sinus inflammation, saline nasal rinses, avoiding known allergens, and appropriate allergy medications recommended by a healthcare professional can significantly reduce mucus production. If silent acid reflux is the culprit, simple lifestyle changes can make a meaningful difference. Eating smaller meals, avoiding food close to bedtime, limiting spicy and fatty foods, reducing caffeine and alcohol, maintaining a healthy weight, and sleeping with the head slightly elevated may help reduce irritation in the throat. Quitting smoking and avoiding vaping are also among the most important steps, as both can continuously inflame the airways and stimulate excess mucus production. It is equally important to avoid constantly clearing your throat, since this habit can worsen irritation and create an ongoing cycle of discomfort. Instead, sipping water or swallowing gently is often a better alternative. While many cases improve with these measures, persistent symptoms lasting several weeks, difficulty swallowing, coughing up blood, unexplained weight loss, or changes in the voice should always be evaluated by a healthcare professional. With the correct diagnosis and a treatment plan tailored to the underlying cause, most people can experience significant improvement and enjoy a healthier, more comfortable throat over time. As we come to the end of this discussion, the most important message to remember is that constant mucus in your throat is not something you should simply learn to live with. In many cases, it is your body's way of signaling that something needs attention. Whether the cause is postnasal drip, allergies, silent acid reflux, dry air, smoking, an infection, or another underlying condition, identifying the real reason is the key to finding lasting relief. It's also important to remember that mucus itself is not your enemy. In fact, it is an essential part of your body's natural defense system, protecting your airways from dust, germs, and other harmful particles. The goal isn't to eliminate mucus completely. It is to understand why your body is producing more of it than normal and address the source of the problem. Simple lifestyle changes such as staying well hydrated, avoiding throat clearing, reducing exposure to irritants, managing allergies, and making healthy dietary adjustments can make a noticeable difference for many people. However, if your symptoms persist for several weeks, continue to worsen, or are accompanied by warning signs like difficulty swallowing, coughing up blood, unexplained weight loss, or persistent hoarseness, don't ignore them. Seeking medical evaluation can help rule out more serious conditions and ensure you receive the most appropriate treatment. Thank you for watching and spending your time with me today. I hope this information has helped you better understand what persistent throat mucus really means and what steps you can take to improve your health. If you found this video helpful, consider sharing it with friends and family who may be struggling with the same issue. And don't forget to subscribe and turn on notifications so you never miss future videos where we break down complex medical topics into clear, practical, and science-based advice that can help you make informed decisions about your health. Stay curious, stay proactive, and take good care of yourself.